The last question that came in is, what is something you hear first-time parents say a lot after baby is born? Or what would you want a first-time parent to know before coming into the hospital?
Yeah, so I think it might just be the lactation consultant in me, but I think the most common question we hear actually isn't about labor at all. It's about, how do I know my baby's getting enough?
Yes.
Right?
Yes.
So I think in general, families do a really great job about planning and prepping for birth.
Okay.
They do a birth plan, they take prenatal classes, they watch videos, and they're really prepped and educated on the labor and the birth and the options and things that can go along with that. And that's great. I'm not saying that that's not great. That's
Right.
awesome.
Right.
But very often I see families almost shell shocked.
Oh,
right?
no.
They've gone through labor and birth, and now they've got this tiny screaming human that they're responsible for, and they're like, oh my gosh, what do I do?
Yes.
Like, I want to breastfeed, but like,
How?
what do I do?
Yes.
So I think they come in with the great intention of, I want to breastfeed, which is excellent. We need that. But I think families could do a little bit more prep as far as breastfeeding goes.
Okay.
So they're all plug in our little breastfeeding class
Yes,
again. So that's
absolutely.
one way that you can help prepare for that, because we definitely see families question, is my baby getting enough?
Yeah.
Right.
And we hear that all the time in our
and
programs
I'm sure
as well.
you guys do
Yeah.
too. Yeah.
Yep.
So I think I'd want families to be aware that, you know, there's lots of free resources out there for education, like our breastfeeding class, like Best Start, Public Health, Ontario 811. I mean, there's lots of really good YouTube videos on positioning and anatomy and physiology, or even just talking to the people around you that have had experience with breastfeeding, and just, you know, exposing yourself to some breastfeeding information is very beneficial ahead of time. That way it's not all
a
brand new and a big shock.
Yeah.
And I find, you know, especially with their first babies, people are very eager when they're pregnant, and they're eager to learn and take in all that information. And so again, I think people focus on the birth and the labor, but at the end of the day, a birth plan is just that.
Yes.
Right? Yeah. It's a plan. Plans change all the time.
Absolutely.
Plans can change very, very quickly. So I think, you know, when you go home, you're left again with this tiny screaming human who's completely dependent on you.
Yep.
And I do find that some people are a little bit like, wow, like there's a lot to know here, and I am not prepared.
Yeah.
So again, taking a class, watching a video, talking to some of your peers or family members, you know, just getting some exposure about what's normal and what you can expect.
Yeah.
Would be really helpful.
Yeah.
And I think I'd want people to know that, you know, colostrum is invaluable. It's so valuable that first day of life. It is all your baby needs.
Yeah.
And your baby's tiny tummy is, again, so tiny that the colostrum is very valuable. And that we are here to support you and advocate for you. We are here to be your biggest cheerleaders, and we want you to have a great birth experience. We want you to be able to tell your friends and family, you know, that I had this great labor and birth experience at Woodstock Hospital. So if there's anything we can do, please, you know, use your words. We're here to help. We're here to support. And we're here for you. And we hope that you can come to us with your concerns, and we'll absolutely be your biggest advocate.
I love that.
Yeah.
I love that. Awesome. I also just want to plug into that once baby is born and you are at home and you're like, what do I do? Make sure you come and check out us at Oxford early on. We are here to help you. We do have baby programs that run weekly, as well as we have lots of drop-in programs. And we have lots of community partners that come into our programs if you need some additional help. Okay, so that was all the questions that came in. So I just want to give a huge thank you to the early on families that sent them in. A huge thank you to Amanda for taking time out of your busy day
thank you
to
for coming.
sit down. And we're gonna, after this video, we are gonna go around the room, so stay tuned. I just want to say too that I delivered 2 babies at this hospital, and hands down 10 out of 10 experiences. The doctors and nurses here really do care about you and care about the journey from start to finish, like Amanda was saying. So I want to thank all the nurses and doctors as well at the hospital for that, and for inviting me in to be able to share this information with you guys. If you have any questions afterwards, like I said before, my email will be in the link below. As well, though, you should always address your health professional if you do have questions outside of my scope. Thanks for joining us, and next month we will be with another community partner. Bye, families.
Thank you.